So having a safety net like basic income can be just the foot up that a family right here in Smith Falls needs. So thank you, Mayor Pankow. The resolution is going forward.
Thank you.
Mayor Pankow, basic income guarantee.
Yes, thank you. We have committee, and I guess the public has the draft resolution in front of them. And this only emerged starting December 14th. Rob Rayner, who is chair of the Lanark Basic Income Network, came as a delegation to Smith Falls for All Committee. And the committee was very intrigued by the presentation, the discussion on basic income, the merits and benefits of what this would mean for both our population and the entire country, frankly. And so we asked Mr. Rayner to come back and to draft a resolution for our consideration that we would then consider. It was approved by Smith Falls for All Committee at our last meeting, and then advanced, of course, to a committee for consideration tonight. So I just want to remind committee that our 2023-2026 strategic plan contains the following vision statement: helping marginalized people move out of poverty. And it really commits us to all do our part. And we know the impact of poverty on our community is deep and broad. And the consequences of poverty on those impacted goes far beyond their quality of life. It extends through every element of their life. Has deeply negative effects on both physical and mental health, and leaves a legacy of hopelessness and lost opportunity that commonly extends for generations. The cost of poverty is estimated to be at least $80 million annually in Canada. The estimated cost of basic income is $80 billion annually in Canada. So basically a trade-off. Poverty leads to fewer early childhood and post-secondary education opportunities, poor mental and physical health, increased social isolation and stress, greater susceptibility to chronic health problems, shorter life expectancies, healthcare costs that are more than double that of food-secure adults. And really, the reactionary results of poverty affect our emergency room, our entire healthcare system, our paramedic service, our police. And with a high probability of children raised in poverty destined to a lifetime of poverty, our community's high levels of people living in poverty will not change without significant change at the federal and provincial levels. And furthermore, I think until we are willing to confront the stark reality that a great number of our citizens and our children are living in deep and difficult poverty, and until we commit to effective and sustained advocacy for these citizens, we are ignoring the needs of 1 in every 6 people in our community. I think many people will acknowledge that the social welfare system in Ontario and across our country is horribly inadequate. And if systemic change does not happen, the negative consequences of poverty will get far worse, and the impact on every element of society will be far more profound and visibly evident. So while this is a national issue, I want to for a moment discuss the realities of poverty in our community. As the resolution before us states, according to a recent census, 16.4% of our citizens are living below the low-income measure. Provincially, that number is 5.3%. With the prevalence of deep poverty in Smith Falls, 3% of the provincial average, I think we need to do more. 785 or 23% of our households had an income of less than $30,000 annually. Another 905 households had a median income between $30,000 and $50,000. Household income, sorry, between $30,000 and $50,000. So that combined, that means 4 in 10 of our families are trying to make ends meet on total household income of less than $50,000 annually. And of course, with the rising cost of housing in recent years, the average rent is now commonly above $2,000 a month. How does a family living off of $2,500 or even $3,000 or $4,000 a month manage? So as we discussed late last year when planning delegations for the Roma conference in January, over 1,000 citizens and an additional 400 dependents rely on the Ontario Disability Support Program as a primary source of income. If they're lucky enough to be housed, their basic ODSP and shelter allowance total $1,308 a month. And if they're not housed, it's about $800 a month. And understanding the province has, through an exhaustive and generally lengthy and difficult process, determined that every ODSP recipient is disabled, unable to work full-time. The probability of brighter days ahead for these citizens is virtually non-existent. So numerous municipalities have recently passed resolutions supporting the need for basic income in Canada, including the city of Kingston earlier this month. I know Napanee, Belleville, and the trend is rolling across the province and the country. So tonight, when we face the question of what we provide our support to this resolution and ask the country, the federal government, to design a program for basic income. I guess think of 1 in 6 citizens in our town who who really struggle, and ultimately the overall benefit and health and wellness of our community improves as the quality of living, the standard of living, and the income of our citizens grows. And I think basic income, it's a time for basic income, the time that we consider the possibility of what this would mean for our community. And economically, imagine what it would do for not just the people of our town, but for the overall broader economy of our community. So at that, I'm available for questions or turn back to the chair.
Thank you. Councillor McKenna.
Thank you, Madam Chair. And I think the mayor has spoken quite eloquently on this. I've been over to the Basic Income Lanark Network meetings. I've heard people who have had a taste of what that life could be like and the impact it's had on their lives. Many more intelligent people than myself have studied this for decades and decades, and I think the time has come. I agree with the mayor. We would not be the first municipality at all to support a resolution like this, and I'm very much in favor of the federal, provincial governments collaborating on the design, introduction, implementation, ongoing evaluation of a basic income program, not just for our citizens, but for the citizens of the country. So I'm very much in favor of this.
But we are talking about 1 in 6 citizens in our community who live in deep poverty. And without system change, that will continue for generations. It'll in perpetuity, we'll never see these things change. And it's hard for people living in poverty, and I hope I'm not sounding a certain way here, but I mean, because I haven't faced that myself, but I've talked to a lot of people. And the reality is, if you're worried about how you're going to eat, how you're going to pay for your rent, how you're going to survive, you're not thinking about getting an education, or you're not thinking about how you're going to start a business, because your brain physically cannot enable you to do that. So the chance for hope, if there's no hope, hope doesn't present itself without some degree of change. And as I mentioned earlier, the cost of poverty in Canada is at least $80 billion annually. So if poverty is $80 billion and the solution is $93 billion, there's not a huge difference there to change the outcomes for millions of people in our community. So what if, and the infographic from the Lanark Basic Income Network speaks smartly about it. What if you're in a violent domestic situation, need to start over? You had a stroke, could no longer work. Your spouse had a traumatic brain injury from a head-on collision, you needed round-the-clock care. If the child's diagnosed with a life-limiting illness, you need to take immediate treatment. Or if you lost your job to downsize and automation. And the basic income pilot that was conducted in Ontario from 2017-2018 had some great outcomes. 26% of participants started education or training programs, so they could get a hand up and get a better start for their lives. 48% volunteered more. 38% of employed participants found higher paying jobs. And any decrease in employment was largely by those who returned to school or stayed home to look after family members. And studies also indicated that 17% of participants quit smoking, 40% smoked less, 5% quit drinking, 43% drank less, and 85% ate more nutritious food. And I just want for a moment to speak to, I happened to run into an individual on Saturday. We were in Toronto, and this gentleman reminded me of how difficult life can be when you come out of difficult situations. And he suffered horrible abuse as a child. He went through 4 years of the most traumatic experiences you can probably ever imagine, from the age of 7 to the age of 11. By the age of 13, he's drinking. By the age of 15, he's using drugs. Eventually, he gets married. His wife dies of addiction. He ends up eventually starting to work, but he falls off a ladder, hurts his back. He falls back into addiction. The reason we connected, he said he knew about Smith Falls because he lived in Brockville for a while, and he went there to Brock Cottage for treatment. He beat his addiction. He made a friend from Smith Falls who was there at the same time, who also beat their addiction. That individual is now successful in our community. But this gentleman has been homeless in the streets of Toronto for 12 years. And he gets $800 a month ODSP because he doesn't get a shelter allowance because he doesn't have a shelter to pay for. And he basically does anything he can to survive. The hospitals do nothing for him. The mental health workers do nothing for him. He basically just tries to survive. And if he had not been through the traumatic experience as a child that he went through, and I won't get into it because there's no need to get into it, life could be normal today. And maybe he would not be suffering from mental health. Maybe he never would have suffered from addictions. And if anyone attended the homelessness session put on by Lanark County last week, you would have heard, and if you haven't, it's on again April 2nd, I believe. Anyway, 90% of people who are homeless are suffering from major childhood trauma. So it's not easy to overcome these things. And so if you're dealing with those types of things in your life, and you also are deep poverty, your chance of exiting by yourself it's virtually non-existent. But if we can build a foundation of support, and then get some confidence, get some hope, believe there's a better future, they can get a better education. Maybe their kids are going to be able to get an education and move on to something better in the future. So I think I respect everyone's opinions, but I think we're talking about 1 in 6 citizens in our community. They're all citizens of our community, and I think we need to do more for them.
And we have 2 more opinions to hear.
Okay.
So Councillor McGuire, if you could chime in.
Thanks, Madam Chair. I appreciate Mayor Pankow's great dive into all the really good reasons for doing it. I'm not going to repeat them. For me, I think former Senator Hugh Segal made a really great case in his book, Bootstraps Need Boots. He was the former Chief of Staff for Premier Bill Davis, former Chief of Staff for Prime Minister Brian Mulroney. And he makes a really conservative argument of how this not only is the right thing to do for social reasons, but there's also a really compelling cost argument for it. So I think that, there's arguments that can be made on both sides. There was really good data that came out of the pilot. I think the pilot ending prematurely was unfortunate, and the least we can do is support this motion tonight. So
thank you. And I'd like to close it out, because this resolution will pass, to just speak about my day-to-day work and to try and do it without getting emotional, because I see hungry children every day in Smith Falls, 2 blocks from here. And so we are seeing the rising pressure on families of food costs. They can't make the rent, and so the kids go without. And we've petitioned the province, I was there, to increase ODSP rates. We have supported the development of new food access programs in our recent community grants. And now it's time to encourage the federal government to help out Canadians who are under this incredible pressure. So having a safety net like basic income can be just the foot up that a family right here in Smith Falls needs. So thank you, Mayor Pankow. The resolution is going forward.
Thank you.